Good day, everyone. My name is Dr. Fundi. Welcome to the Health Matters podcast by Dr. Fundi. Today being the 9th of the 9th month of 2023. In the health calendar, in the international health calendar, is designated the Fetal Alcohol Syndrome or Fetal Alcohol Spectrum Disorder Awareness Day. But also in our national health calendar here in South Africa, it is recognized as an important international health day that we need, to commemorate or celebrate or create awareness about. So we are discussing in simple terms problems relating to alcohol consumption by the mothers whilst they are pregnant, and what can go wrong with their unborn babies, but also what can go wrong that may manifest or show itself after the babies are born. So we are tackling that problem today. And as usual, I've got my colleague, Mr. Sipho Masigo. I call him Dasiga. We will be talking about this issue. It's a very, very, very big issue, and it deserves a lot of attention. But we will talk more about that, in the next few minutes. Welcome, Mr. Masigo.
Thank you for having me, Doc, and good evening and good afternoon to all the viewers of the Dr. Fundi Health Matters podcast.
So I'm going to hand over to you.
Yes.
You've got a list of prepared questions that are meant to elicit relevant information that we are going to be sharing with our viewers about fetal alcohol syndrome or fetal alcohol spectrum disorder, which is a name that nowadays is being used when we talk about this matter.
Absolutely, Doc. The first question to you, Doc, is what is fetal alcohol syndrome or fetal alcohol spectrum disorder? This is all new to me, Doc.
Yes, so I'm going to give you a technical definition.
Okay.
All right? But for now, let me just summarize it by saying this is a group of problems that are related to mothers consuming alcohol during pregnancy and how that alcohol actually affects their babies. So a technical definition, though, is this is a condition in which alcohol causes growth problems, brain damage, behavioral problems, and developmental issues in unborn babies. So this is stuff that happens before we even see the baby, being born. Stuff that happens in that first trimester when the organs are forming, stuff that happens during that middle trimester, when the organs are actually becoming, developed, well developed, or problems relating to the functioning of those organs, just in that last trimester. So basically, the damage can happen at any of the trimesters of pregnancy. And so there's this saying that there are no two babies with this spectrum disorder who present exactly the same way. Okay. Because it depends on the amount of alcohol that the mother was drinking. It depends on whether they drank a lot during the first 3 months, the middle 3 months, or the last 3 months. Obviously, the biggest danger is in that first 3 months, because that's when most of the organs are actually forming, especially the brain. So that's why they are now calling it a spectrum, because there can be so many different presentations but the underlying problem is alcohol. So that is the definition of fetal alcohol syndrome. So fetal alcohol spectrum disorder is now a global term for the permanent and irreversible physical and psychological conditions on a fetus that is caused by a pregnant mother consuming alcohol. So from a definition point, those are the definitions.
So why is this a problem, and why are we dedicating a day to focus on this?
Well, it is a major problem. It's normally said this is the most, or commonest non-genetic cause of abnormalities in the organs of the babies,
Non-genetic.
So, non-genetic.
Okay.
All right. So I'm saying this is a preventable cause, which is alcohol consumption, as opposed to a problem that is caused by some gene that somebody has inherited.
Okay.
Yeah. So it's the leading cause of non-genetic, non-genetic cause of abnormalities in the brain, in the organs of babies. Yeah.
So how big is this problem globally, Doc?
Well, there was a study that was done that looked at 187 countries. Yeah. And amongst those countries was South Africa. It found that South Africans have the highest rate of FASD, that is fetal alcohol spectrum disorder. And they looked at 1,000 live births to say, if there's 1,000 live births, how many of those will have this problem? Yeah? And they compared South Africa and the other countries. On average, globally, 7.7 children per 1,000. That is, the prevalence of this problem.
Globally.
Yeah? Globally. Yeah. 7.7 per 1,000 live births. Yeah? But when you look at South Africa, we stand out like a sore thumb, at 111 per 1,000. Yeah? So when you look at the multiples of that 7.7, because we're at 111, we are more than
100 times.
No, not really. Maybe 20 fold.
Yeah.
But we are up there.
Yes.
So it is a major problem globally, but our country, South Africa, we has the worst problem. Of this fetal alcohol spectrum disorder. In places like the US, maybe, the numbers are actually relatively low, compared to what we are seeing here in South Africa. But I think we cannot necessarily be surprised as South Africa.
Okay.
In terms of this. We have a poor relationship with alcohol, generally.
Yeah.
As a society.
Yeah.
We rank very highly, within the African continent in terms of the consumption of alcohol on an annual basis. The last time I checked, we were in the top 20 in the world as a country in terms of alcohol consumption. And our type of drinking, we tend to binge, we get paid on a Friday.
Yeah.
We go big drinking over the weekend, and stuff like that. So we tend to binge drink in South Africa rather than drinking, let's say, on a day-to-day basis. So if that is the society that we have with that poor relationship with alcohol, it cannot surprise us that the women folk who are part of the same population will obviously, have problems with alcohol consumption during pregnancy. Yeah.
Is it because of our history? Does our history have anything to do with our consumption of alcohol?
Well, I would say yes, but maybe let's zoom in deeper in terms of this fetal alcohol spectrum disorder.
Okay.
Now, whilst we are saying in South Africa it's 111 per 1,000 live births, but when we look, across the 9 provinces of South Africa, the prevalence of this problem is actually not uniform. Yeah. Some provinces have got a much bigger problem than others. For example, on my way here, I was listening in the news. The Western Cape, there's about 32% prevalence, of fetal alcohol syndrome. 32%.
Yes.
That's basically 1 in 3 of babies born in the Western Cape have this problem. In the Northern Cape, 28%. Yeah? So that's almost like 1 in 4, just over 1 in 4. So those 2 provinces have the highest prevalence of fetal alcohol spectrum disorder in South Africa. But that does not mean other provinces don't have the same problem, because like I said, we have a national problem of a poor relationship with alcohol. So whether it is KZN, Eastern Cape, Northwest, Limpopo, Mpumalanga, Gauteng, we have the problem. But I'm just highlighting the 2 provinces that for years, in fact for decades, they've been having this problem. So now, back to your question then, does our history as a country have anything to do with this? The answer is yes. I'm talking about fetal alcohol, spectrum disorder.
Yeah.
So if you look at the 2 provinces, especially let's focus on the Western Cape. The Western Cape, one of the big employers in the Western Cape are the wine farms. Yeah. The wine farms are the biggest employers of unskilled or semi-skilled workers, in the Western Cape. Now, historically, the farmers were quite naughty. Instead of paying money, proper money to their workers, that is the farm workers, they would pay them with alcohol. A system that was called a DOP system. DOP means like drink alcohol. So there was this DOP system that was used to pay the workers in the wine farms, in the Western Cape in particular. And this obviously became the highest population in those wine farms is a certain population group, but I'm not just going to focus on that right now.
Yeah.
But historically, the DOP system is definitely one of the contributors. And so that legacy, even though publicly now no farm can actually say it uses the DOP system, but the question is, and the farms where that practice is still there in a way. So, but obviously there are many other issues that make people to drink, but in these 2 provinces, yes, there's not a lot of wine farms in the Northern Cape, but there's a lot of migration,
of course,
between the Northern Cape and the Western Cape. So those are historical issues. But in terms of South Africa as a country, if you remember, at a certain point, I think before the 50s, if I'm right, black people in general were not allowed to purchase spirits, alcohol.
Okay.
Yeah. No, they were encouraged to drink, traditional brew, sorghum beer. That's why there were those beer halls in the hostels.
Yes.
So if you needed to buy spirits, you needed to do it in a way where maybe you ask somebody who has a lighter complexion to go in and buy the alcohol for you,
Yeah.
because it was not supposed to. So when that stopped, when you've been denied something,
Oh, okay. Yeah.
as soon as you've got access to it,
Yeah.
sometimes you can overdo things. So I think we are still suffering because the way we consume the spirits and beers and all types of alcohol. We're no longer so big on Sokam beer like it was many years ago.
Umqombothi.
Yeah. So what I'm trying to say is, your question was actually a very important question. Some of the issues or the legacies of the past are still driving some of the challenges we have with alcohol consumption today. And therefore, we should not be surprised at this high consumption rate of alcohol and the problem it causes to those mothers who are pregnant. But there are other causes really for the alcohol consumption in general. There are a lot of social ills or socio-economic ills in South Africa, and some of those could be driving, because as people are not coping with the stresses, they find escapism, escaping into alcohol, finding solace in alcohol as a good coping mechanism in terms of their day-to-day stresses. So we can go on and on, trying to explain what is behind the poor relationship that South Africans have with alcohol.
Absolutely. Doc, we did put out our conversation and asked ladies to send us voice notes. So we do have some voice notes from the ladies. And let's take a listen to our first voice note that has come through to add to our conversation. Can we do that, Doc?
That's fine. Let's go ahead.
Okay.
Let's go ahead. Yeah. It would be nice to hear. Yeah.
Okay. All right. Let's do that.
Well, most women, hi, my name is Babalwa, and I just wanted to say, from my understanding and I think my observation with regards to women drinking during pregnancy, it's because of stress. It could be because of rejection that they come across, because the man has actually rejected the pregnancy. But I understand that in our day and age, women go through so much, and I'm not condoning drinking during pregnancy, but I also think we have addiction issues as a country in terms of alcohol. But I've heard ladies who say, I was drinking right through my pregnancy. I didn't know. Sometimes it's mainly because they are not aware of the actual fact that they're pregnant. So I think it's lack of awareness, because some slip around during that. And the binging is caused by stress due to rejection as well from the father. So, yeah, those are the key factors. And I think we need to be educated enough in terms of why women drink during pregnancy and how it affects the child. I don't think that is being said as much as it should.
There you have it, Doc. Sis Babalwa.
Sis Babalwa is actually spot on, when she talks about this matter. One of the things that she's highlighting is that generally women are stressed.
Yeah.
There's a lot of psychosocial or socio-economic issues that are driving them to high levels of stress. And so they then use alcohol as some form of coping mechanism or an escape mechanism from their daily realities. But she also raises another issue, the issue of lack or inadequate awareness about the dangers of alcohol consumption during pregnancy, because other people, like what she says, they've been drinking the whole pregnancy because they didn't know that that is harmful to the unborn baby. So that justifies why we have a day like we have today, which is, Fetal Alcohol Spectrum Disorder Awareness Day, because we want to make people aware that drinking alcohol whilst you are pregnant can endanger the life of that unborn baby, and that baby may be born with serious disabilities, in the brain or other organs, the kidneys and the heart and things like that. So I think it's very, very important that we continue doing the work that we are doing, so that we can save many women from this problem.
So, Doc, you've touched on some of the damages that can cause to a child. So, what are the long-term damages that comes with this problem?
All right, let me just broadly say, the severity of fetal alcohol syndrome symptoms or spectrum symptoms, they vary.
Okay.
Some children, may experience them to a far degree than others.
Okay.
Remember, I said there's no two kids with the same problem that have exactly the same kind of presentation.
Okay.
So the symptoms of fetal alcohol syndrome, they are usually a mix of physical defects, intellectual or cognitive disabilities, and also problems of functioning and coping with daily life. Let me be much more specific. At a physical defect level, there's a typical look. Anyone who's working in the labor ward for some time will be able to identify a child with this problem. They normally have distinctive facial features, including small eyes, an exceptionally thin upper lip, a short upturned nose, a smooth skin surface between the nose and the upper lip. All right? Smooth skin surface there. Deformities of the joints, limbs, and fingers. All right? So that is affecting the bones. There may be slow physical growth before and after birth. All right? So a baby may be born very, very small, even though they've grown up to term. That is the 9 months of pregnancy. There may be problems with vision or hearing, which obviously may affect the child when they start schooling. They typically have a small head circumference and the brain size. And they normally also have problems with heart abnormalities and also abnormalities with the kidneys. So those are the physical defects. But in terms of the damage to the brain, it may lead to poor coordination or balance. It may lead to intellectual disabilities, learning disorders, and delays in development, poor memory, trouble with attention and processing information, difficulty with reasoning and problem solving, difficulty in identifying consequences of choices, jitteriness and hyperactivity, and rapidly changing or swinging moods. That is problems relating to the damage on the brain. And at a social and behavioral level, there could be problems in functioning, coping, or interacting with other people, leading to difficulties at school, getting trouble along with others, poor social skills in general, trouble adapting to change or switching from one task to the other, problems with behavior and impulse control, and having a poor concept of time, problems staying focused on one task, and difficulty in planning or working towards a goal. Those are just some of the problems that you are likely to see. So it is important that we understand that this damage that is caused to that unborn baby, that can be permanent and irreversible. In fact, it is irreversible. There's no treatment to reverse the damage that has already happened, So that's why we really trying to say to people, don't drink as soon as you know that you are pregnant. In fact, we go further. We say, if you are planning to fall pregnant, please abstain. You prepare your body, you prepare your womb, so that by the time you do fall pregnant, the environment is actually ideal for your child to grow. Because if you consume alcohol during pregnancy, then the environment is not necessarily ideal. Hence, the problems we've talked about around, brain damage, social behavioral issues, and also physical defects that can happen to that unborn baby.
Absolutely. Doc, does it matter if somebody drinks every day or binge drinking during pregnancy?
That's a very, very important question, Tasiga, because, there is this belief from some people. There is this belief that, if you just drink one glass per day, that will be okay. It won't cause any damage to the baby. Now, that's a mistaken belief. In terms of literature, scientific literature around this issue, there is no amount of alcohol that has been found to be safe for the unborn baby. Meaning, if you are pregnant, you must not touch alcohol. So this matter is 100% preventable. Yeah? 100%. You don't drink, then there will be no fetal alcohol spectrum disorder. So the people who go around and say, no, if you just take one glass of wine, that will be okay. No amount of alcohol is safe for the unborn baby. Therefore, people should completely abstain from drinking alcohol during pregnancy.
All right, Doc. So we've got another voice note. Let's take a listen to it. And I think this one comes from May Elaine. Let's take a listen.
Okay.
Good morning, leadership. This is a great subject with also a great challenge, because the current environment that we're living in, it's making the situation worse, and a lot of kids are born with abnormalities through this drinking during pregnancy. It's not only the drinking, it's also drugs that causes this. But the social environment that they're living in, they can't cope, the women can't cope with what they go through. The unemployment rates, the poverty, the violence, the abuse that they go through. So it is, they find they just resort themselves to alcohol. And that's the only way that they can sort of console themselves. It's becoming a serious challenge in our society, in the communities, especially the underprivileged and the low-income areas. This is where the challenges are greater. The abuse that they go through, the gender-based violence, is another effect it also has. So I think it's a great discussion, but there needs to be a lot of awareness of this subject, the alcohol during pregnancy, especially amongst the teenagers, a lot of the young girls that are drinking, going clubbing, and having these babies. It really has become a serious impact in the communities.
There you have it, Doc. Umama there was watching TV in the background, sending a voice note.
Okay, no, I was wondering what is this,
Yeah.
But anyway, I think she raises serious issues.
Yeah.
In fact, what she's saying is sort of aligned to what was said by the first, voicemail, Ngubabalwa, where she's highlighting, social ills or socio-economic problems as the driver of people, having high stress and therefore using alcohol as a coping mechanism. So I cannot agree with her more. That certainly does play a role, to the kind of issues that we are seeing. Not only, this fetal alcohol, spectrum syndrome, or spectrum disorder rather, but I mean, in general, we have many problems in our country, and people are just not coping. Unemployment, poverty, and many other social ills are really impacting people, negatively. Others, the pregnancy itself is an added stress because they don't know what they're gonna do. They are already unemployed. Where are they gonna get the money to buy the clothes, to buy the food, and all of the responsibilities that come with, having a baby. So that already can stress people, and they end up consuming alcohol whilst they are pregnant.
Absolutely. Doc, can the damage done on the baby be reversed or cured?
The answer is a simple one. The damage done to the developing organs of a baby during pregnancy, which then obviously we start to see the damage after the baby has been born. That damage is irreversible. It's permanent. So they will carry that into, childhood, into adulthood, and quite a number of these, people who are born with this spectrum disorder, they have such serious, mental, problems, such that they may not even be able to cope at school. So learning difficulties. You heard about visual problems, hearing problems, so learning difficulties, inability to concentrate, inability to focus, behavioral issues. So basically they never reach their full potential. It's irreversible. And therefore, rather a parent abstain for that 9 months and save their baby from lifelong problems than to continue drinking and risk a situation where the baby will be born with some serious disabilities, which would make them to be unable to thrive and compete in the open world.
So, Doc, is there any amount that a mother can drink, or are they not allowed to drink at all during pregnancy?
I'm repeating it. Not even a drop.
Yeah.
Guys, just don't drink.
Yeah.
Yes, there could be those people who already had addiction problems prior to them falling pregnant. We normally advise that if you've got an addiction problem and you are planning to fall pregnant, first get professional help to deal with the addiction. Then you can fall pregnant thereafter, once that is managed. So other people, even though they know that the drinking during pregnancy is problematic for their unborn baby, but they may not be able to stop on their own. So if those people are picked up early during the pregnancy, it's important that they get to be referred, for rehabilitation with their substance abuse problem. And sometimes it's not only alcohol, it's alcohol and other, substances that are illicit, dacha or even hard drugs.
Absolutely.
Yeah.
Doc, we've got another voice note. Let's take a listen to it from another female who sent us a voice note a bit earlier. Let's take a listen to this one.
Afternoon to you and your viewers. My name is Queen, and on this topic, it's a very difficult topic, especially when it comes to the socio-economic challenges that we are facing as a country, and some of the social ills that different communities face on a daily basis. So currently, we are facing a lot of women that are unemployed, men that are unemployed. We are having so many people that are less skilled and abuse alcohol even before they fall pregnant. So at times, people fall pregnant even before they abuse alcohol even before they fall pregnant. So it's a bit of a challenge because some people feel that the only way to deal with stress and depression is through alcohol. So a lot of these women find it very difficult to open up about their problems. With everything that's going on, different social ills and challenges, the only comfort for women is alcohol. So I believe that mental health should be introduced from early ANC, the antenatal classes. Immediately when a woman comes to book for an antenatal class and stuff, mental health should be a priority, and it should be a necessity, especially counseling for these women, for them to open up, because the only thing that you go to when you go to these clinics, you only go to check on the baby, not the woman. So somehow we need to ask ourselves if is the baby the only important soul, or is the mother and child important together? Because a lot of women drink alcohol because of a lot of challenges that they face on a daily basis.
Sure. Doc, she raised some important points there as well.
Well, she communicates what has been communicated in the previous two voice notes around socio-economic or social ills. So I won't dwell into that one.
Sure.
But she raises another, very important point, that, antenatal clinics, that is those visits to the clinics when a person is pregnant. Usually once a month from around the 16 weeks, they go and be seen. They are screened for HIV. They are screened for many other, health conditions. They are screened for things like rubella and whatever. So what she's saying is that in addition to the physical or the screening of physical illnesses, there should also be screening for mental health challenges.
Oh, I see.
So that those people who are struggling at a psycho-emotional level can be picked up at that stage, early stage of pregnancy, so that they can get assistance from a counseling or even rehabilitation point of view. So I think that's a valid point, because our health system in general, it's geared towards physical health. You know, we are still very far from providing, adequate mental health services across, at a primary healthcare level, at a secondary care level. We're not providing that. So as a country, I think we need to prioritize mental health services. But in this case, we're talking of an at-risk group, that is pregnant mothers. The advice, or what she's raising is, let there be screening for mental health and proper interventions timeously. That could go a long way in reducing the amount of drinking that the mothers, get involved in during their pregnancies.
I think another thing she raised, Doc, is the priority on the mother or the child?
Well, we talk of maternal and child health.
Okay.
Right? Maternal and child health. A few years ago, Dr. Mutsualedi, who was the Minister of Health, used to talk of a quadruple burden of disease in South Africa. You would be talking about, obviously, HIV and AIDS as a problem in the country. He would talk about issues around, unnatural deaths and violence as another big issue in South Africa. He would talk about non-communicable diseases being a big problem in South Africa. But he would also mention issues around maternal and child health, problems with the mothers and problems with the babies, So in the context of us understanding that one of the key health challenges in South Africa is issues relating to mothers and children, when it comes to antenatal clinics and the work that is done there, I think the focus can't just be on the baby alone, or the focus can't be on the mother alone. I think there has to be a holistic approach that is looking at risks relating to the mom, but also risks relating to the unborn baby. So she's very right that there must be prioritization, not only on the baby that is still in the tummy, whether that baby is growing well, is the size right for the length of the pregnancy and all of that, but she's saying, look at the mom who's carrying the baby. She also needs to be prioritized. So I cannot agree with her more.
Absolutely. Doc, we've got about 15 minutes to go. There's another interesting little clip that I wanted to play. Apparently, women who drink alcohol while pregnant could face criminal charges.
Wow.
I want to play this for you, and then maybe we can have a discussion around it.
Yeah.
Can I go ahead with it?
Please, go ahead.
Okay.
Yeah.
Now, we have seen women drinking in public sometimes while they are pregnant. But here's a new twist to this. Women who drink alcohol while pregnant could face criminal charges. That is the view of the Deputy Social Development Minister, Deputy Minister Henrietta Zulu. She says it's the leading source of non-genetic developmental as well as intellectual disability disorder. Let's speak to the Deputy Minister now ahead of the International Fetal Alcohol Spectrum Disorders Awareness Day, which comes up shortly. A very good morning to you, Deputy Minister, and thank you for your time. First of all, let's talk about the fetal alcohol disability syndrome. What exactly is that? What are the symptoms?
Good morning, Tammy, and to the viewers of ETV. I think we need to start by demystifying the language. When you say fetal alcohol syndrome, it kind of like sounds very fancy. We must just get
Doc, I think we'll play it up until there, because I know the clip is a bit long, but you heard it. Do we have a law?
Well, so the person that is being quoted there is the Deputy Minister of Social Development.
That's correct.
Yes, who herself is somebody who's living with a disability.
Okay.
Yes, Bohopane Zulu.
Oh,
Yes, I think she's got a visual impairment
okay.
or visual disability. But anyway, that is not important. What is important is what she's saying. She is highlighting the fact that this is a big problem. I think she has identified the fact that at times we as health professionals, we tend to talk above the people and even the words that we use. So she says she wants to simplify this thing by saying those babies who are born drunk.
Yeah.
It's an oversimplification, though, because it does not mean that all children who have got this problem of, alcohol, fetal alcohol spectrum disorder will be born drunk. Some, the mothers will no longer be drinking in the third trimester, but the damage was done in the first trimester. So I think if we only looked at babies born drunk, we would miss so many of these babies. So I can understand her urge to simplify the language that is used, but unfortunately, in trying to simplify, she could also be just creating a situation where people will only focus on whether the child is drunk or not. I must say, though, it's something that's very interesting. Those mothers who are drinking even, just before birth of the child, in the third trimester, around 38 weeks, we do see, in the labor ward, we do see kids who come out drunk, and others a few days after being born, they've got withdrawal symptoms. Because the mother was drinking almost on a daily, and therefore the baby was getting alcohol almost on a daily.
Yes.
So the baby is addicted, and so day 2, day 3, they start having problems, tremors and all some of the symptoms that we see on an adult who is having, withdrawal symptoms, or sudden drop in the blood sugar and other symptoms, so it is possible to see a child coming out with alcohol, abuse, withdrawal symptoms. So she is right there, but not all kids with this spectrum disorder come out drunk. But we are trying to highlight problems in terms of, the defects at a physical level, the problems at a brain, intellectual level, and also behavioral, kind of challenges that may arise. So she's trying to, simplify, but in the same breath, I think her simplification maybe is not very, very, very good, because it makes us to forget or turn an eye away from some issues. So I think, but on the issue of mothers being criminalized for drinking during pregnancy, it's a very difficult one. I can understand from where, whoever that came with, I think if it's the deputy minister, I can understand, why she's advocating for something like that. But my worry is that, to criminalize a mom, you would have to really, find an intention to harm, because another one may have been drinking not because they want to, but because they are addicted. And some people have got a predisposition to addiction, through genetic, through the genes that they inherit from their parents. So it's not a simple matter whereby you were being irresponsible. Why did you drink? And therefore, let's criminalize you. But I think what we need, though, is to increase the awareness about this problem. This is one of the problems where we are champions of the world. You know, we're starting the World Cup tomorrow, which is Sunday, Rugby World Cup in France, and we're hoping that we can become world champions. We'll retain our championship.
Yeah.
But this is one area where year after year we are retaining our championship in the world as being the country with the highest percentage or number of kids who are born with defects relating to alcohol consumption by the moms, during pregnancy. Another area where we are world champions is the number of people who are living with HIV. South Africa, there's no country in the world with as many people who are living with HIV than South Africa. So these are not championships that we really like. We like being champions in rugby. We hope one day we can be world champions in Bafana and also with the Proteas. But being champions, world champions in terms of the moms who are, or babies who are born of moms who were abusing alcohol or HIV are not good stats to be proud about. Yeah,
absolutely. Doc, now that we've spoken about this being a national crisis, is there a policy to guide the provinces? You spoke of the Northern Cape and Western Cape, to guide them, because clearly this is a problem that needs a solution.
I must say that whilst this problem is a problem that shows that this country has a national crisis, and obviously some provinces worse affected than others. To my knowledge, there hasn't been a policy that provides the necessary guidance, on what needs to be done by all the relevant stakeholders, what programs should be put in place, by whom, and the measurements, in terms of performance, in terms of those programs that are rooted in those policies. I could be wrong. I know that the Western Cape provincial government, this is an issue that they deal with and they take it very seriously. It could well be that at a provincial level, they've got, their own policy. But at a national level, I am not aware, but I stand to be corrected.
Maybe my last question to you, Doc, maybe you can speak to this and address this issue. Maybe some advice to the ladies around, or mothers, around the complications, the prevention, the coping and support, just how they can deal with all of this, Doc.
Look, this is a serious matter that we're talking about. And I must say that, there are problem behaviors that are sometimes not there at birth, that arise from fetal alcohol, spectrum disorder. And some of these complications are things like ADHD, that is attention deficit hyperactivity disorder.
Okay.
Problems like aggression, inappropriate social conduct, breaking rules and laws, alcohol and drug misuse, mental health disorders like depression, anxiety, and eating disorders, problems staying in or completing school, problems with independent living and with employment, inappropriate sexual behaviors, and early death by accident, homicide, or suicide. So those are just some of the potential complications on these, lives that are brought in on earth, who then have a challenge of the fetal alcohol spectrum disorder. Now, you heard me saying this problem is 100% preventable. If people don't touch alcohol during pregnancy, there wouldn't be fetal alcohol spectrum disorder. Not at all. There are certain guidelines, that are followed to try and prevent this problem. The first one is don't drink alcohol if you are trying to get pregnant. Yeah. So if you have an intention with your partner, that you make a baby, stop drinking. All right. But obviously there are situations where people are not aware that they are pregnant, and so they continue drinking. So as soon as they know that they are pregnant, then the drinking should stop.
Yeah.
Yeah. You will notice there I'm talking about they. When I was growing up, pregnancy was something that we're associating only with the ladies.
Yes.
But nowadays we talk about we are pregnant.
Yeah.
We are pregnant because it takes two to make that pregnancy. But there's only one person who carries the pregnancy. But we talk about we are pregnant.
I heard a guy say that this week.
Yes. We learn every day.
Yeah.
The second tip is continue to avoid alcohol throughout pregnancy. Fetal alcohol syndrome is completely preventable in children whose mothers don't drink during pregnancy. Consider giving up alcohol during your childbearing years if you are sexually active and you are having unprotected sex. Many pregnancies are unplanned, and damage can occur in the earliest week of the pregnancy. So one may not know that they are pregnant. And if you are not using any protection, then you are at risk. If you have an alcohol problem, get help before you get pregnant. Get professional help to determine your level of dependence on alcohol and to develop a treatment plan. Those are just some of the tips that are out there. And in terms of the last thing that you were talking about, firstly, there's no specific cure or treatment for fetal alcohol syndrome, right? Those physical defects or mental deficiencies, they will last a lifetime. But early intervention may reduce the effects of some of the, presentations. So involvement, for example, of special education teachers, speech therapists, physical therapists, occupational therapists, psychologists, they may reduce the impact, and in some situations, medications may also, assist, and problems like visual problems or even heart problems, they can also be addressed. So not all is lost, but the problem can be reversed. It can just be contained, but it can be reversed. So in terms of coping and support, the psychological and emotional problems associated with fetal alcohol syndrome can be difficult to manage for the person with the syndrome and for the family. So family support, very, very important. Children with this fetal alcohol syndrome or spectrum disorder and their families may benefit from the support of professionals and other families who have experience with this. And it's also important to deal with the behavioral problems. As a parent of a child with this problem of fetal alcohol syndrome, you may find the following suggestions, in dealing with the problem of the syndrome. It's important to recognize your child's strengths and limitations, implement daily routines, create and enforce simple rules and limits, keep things simple by using concrete, specific language, use repetition to reinforce learning, pointing out and use rewards to reinforce acceptable behavior, teaching skills for daily living and social interactions, and guarding against the child being taken advantage of by others, because many children with fetal alcohol syndrome are at risk of this. So as I was reading all of these, it's the kind of things that we also recommend, for children with autism spectrum disorder, which we'll talk about sometime next year. Those are just some of the tips, but what's important is seek professional help, because by doing so, you could minimize the impact, but it is not reversible. So that's all I can share for now about this problem. It's a major problem in South Africa, and it is something that we really need to prioritize, and it is growing, as we go forward. And so let's deal with it head on, and hopefully we can manage it. Yeah.
Absolutely, Doc. Thank you very much. That was very informative. Thank you, Doc.
Lovely.
Absolutely.
Thank you to our production team, and thank you to everybody who will join in. Remember, subscribe, share, and like. We believe we are producing content that should benefit many people. So once you've listened, please share so that others can benefit as well. Thank you.
Thank you, Doc.